Hello viewers, I am Dr. Robiul. I work as a lecturer in pathology in a medical college hospital, and I am making this video for my students and also for you. Hope someone finds this helpful. Today's topic is on fibrosis. This video will contain the definition of fibrosis followed by its causes, the mechanism of scar formation, and since matrix metalloproteinase plays an important role in fibrosis, so we will talk briefly about matrix metalloproteinase, and we will finish our discussion today with the role of macrophage activation in fibrosis. Okay, so a lot of topics, so let's begin. First question, what do we mean by fibrosis? How can we define it? So, as written in your textbook, fibrosis can be defined as excessive deposition of collagen and other extracellular matrix components in a tissue. Okay, I hope you are still with me. You didn't run away just like my students do when I try to teach them definitions of pathology. I even have to show them teddy bear to keep you calm. So look, I am also showing you a teddy to keep you calm. So don't run away because I will try to explain this definition now. So I am repeating the definition again for my students. How can we define fibrosis? Fibrosis can be defined as excessive deposition of what? Excessive deposition of collagen and other extracellular matrix components in the tissue. Now, what is collagen? Always remember, collagen is the most abundant structural protein in mammals. Okay, and what is extracellular matrix? Extracellular matrix is a collection of various extracellular molecules. That means these molecules are outside the cell, and usually they are secreted by different types of cell, and that collection of extracellular molecules outside the cell that are responsible for the structural support and also for various biochemical function outside the cell, those things make up the extracellular matrix. So why am I telling you about collagen and extracellular matrix components? Because according to the definition, whenever in certain tissue there is excessive deposition of this collagen and other extracellular matrix components, that will result in fibrosis. And always remember, the extracellular matrix contains basement membrane and interstitial spaces, and collagen is a very important component of the basement membrane as well. And there are various types of collagen and they have different structural function. So now that we have defined fibrosis, you must know one important thing, that is the term scar and fibrosis are often used interchangeably. And always remember, whenever there is fibrosis, fibrosis can be associated with tissue loss. So now that we have defined fibrosis, now let's move on and talk about the causes of fibrosis. And as you can see in the board, I have a flowchart depicting different steps of fibrosis, and look what I have written in the beginning: persistent stimulus. If I want to be more clear, persistent injurious stimulus, that is the main cause of fibrosis. So whenever there is persistent injurious stimuli in certain tissue, that can result in fibrosis. Now, when will we have such persistent injurious stimuli? It can happen during chronic infection, it can happen during certain autoimmune reaction. For example, in certain autoimmune diseases, we can have fibrosis. So the first cause of fibrosis was chronic infection. The second cause is during certain immunological reaction, for example, during some autoimmune reaction. And also, fibrosis can also result from trauma. So these are the major causes of fibrosis. Chronic infection, autoimmune disease, trauma, all these can result in fibrosis. So now that we have defined fibrosis and mentioned its major causes, now let's move on to the next topic and talk about the mechanism of fibrosis. Now the basic mechanism of fibrosis is similar to the mechanism of scar formation in the skin that we see during tissue repair. So let's talk about scar formation first. Now, in order to understand scar, first we have to know a thing or two about wound healing. Always remember, wound healing can happen in two mechanisms. One was regeneration, and the second mechanism was by deposition of connective tissue. And during this second mechanism, during deposition of connective tissue, scar can be formed. So now you may be asking me, Dr. Rabiul, what do we mean by regeneration? Always remember, when the damaged tissue is able to replace all the damaged or lost cells with similar type of cell, and when after that replacement the damaged tissue is again back to its normal state, that is known as regeneration. And in many cases, regeneration is not possible. For example, if there was damage in the non-dividing cell, non-dividing cells or permanent cells, they do not divide. So in that case, regeneration is not possible. Similarly, if there was severe or extensive tissue damage, the regeneration alone would not have been sufficient to heal that tissue. And in many cases, the connective tissue structure or the connective tissue framework may have been lost. And in all these cases, regeneration alone cannot fix the tissue. And in those cases, deposition of connective tissue occurs. And it is something like a patchwork our body is doing. Whenever our body cannot replace the lost tissue, it's replacing those damaged areas with connective tissue. And that is the time when we can see scar formation. Now, scar formation has several steps. The steps will include angiogenesis, formation of granulation tissue, and remodeling of the connective tissue. So let's talk briefly about these three terms. So what do we mean by angiogenesis? Well, I have a separate video entirely on angiogenesis, but to say in short, angiogenesis means formation of new blood vessel. Now, you may be asking me, Dr. Rabiul, why are we forming new blood vessel when we are trying to fix a tissue with the help of connective tissue? The answer is, during the repair process, the cells also need oxygen and nutrient to continue this repair process. And the only way to provide oxygen and nutrient to the cells that will participate in this repair process is to increase their blood supply. So therefore, we are having formation of new blood vessel as the first step of scar formation. And one important property of these new blood vessels are they are very leaky. They have increased vascular permeability. And the new blood vessels that we are seeing here during angiogenesis will be leaky due to two causes. First of all, since these are newly formed blood vessels, so they are not very mature. They are immature blood vessels, and they have incomplete interendothelial junctions, and for that they are leaky. And the second cause is an important growth factor is released during angiogenesis, that is known as vascular endothelial growth factor, and or VEGF, and that growth factor drives the process of angiogenesis, and that growth factor is also responsible for increased vascular permeability. So that was in short about the first step of scar formation or angiogenesis. The second step is formation of granulation tissue. Now, what do we mean by granulation tissue? Now, the term granulation tissue is derived from its gross appearance. Grossly, granulation tissue looks like a granular pinkish and soft tissue beneath the scab. If you have seen a skin wound, you will remember that whenever there is any wound in the skin, first there is formation of scab, and that thing prevents dehydration and infection of the underlying wound. And beneath the scab we see the granulation tissue. And this granulation tissue is formed by migration of fibroblasts. So fibroblasts will come to the site of injury, they will migrate to the site of injury, and then they will increase their number, they will proliferate, and then they will release a lot of loose connective tissue. And like I said in the previous step, there will be also angiogenesis in the second step as well. So we will see granulation tissue that will contain fibroblast, loose connective tissue, extracellular matrix components. There will be also some presence of new blood vessel, thin-walled capillaries due to angiogenesis, and also there will be a lot of inflammatory cell, mainly macrophages. So all these things will happen during the second stage of scar formation. Then the third stage of scar formation will come, and what will happen during the third step. Now, as the healing process progresses, the number of fibroblasts and the number of newly formed blood vessels that we had seen in the granulation tissue, the number will begin to reduce. But at the same time, you have to remember that the fibroblast will also have increased synthetic phenotype. That means although the number of fibroblasts is reducing, the fibroblasts will, as a matter of fact, produce more and more connective tissue. So there will be more deposition of collagen and other extracellular matrix components. So what will happen next? Ultimately, the highly vascularized granulation tissue that we had seen in the previous step, that will be replaced by largely avascular and pale scar tissue. And sometimes the fibroblast will be converted into myofibroblast. And what is myofibroblast? That is a modified fibroblast that has smooth muscle-like activity, and there will be presence of actin filament inside the myofibroblaст to give its contractile properties. And myofibroblasts are very important for wound contraction. Now, I have two separate videos on wound healing, so you can look into those videos for more information regarding wound contraction and wound contracture. The next thing that will happen during scar formation is remodeling of connective tissue. Now, what do we mean by remodeling of the connective tissue? Now, always remember, there must be a balance between the synthesis of collagen and other extracellular matrix components and their degradation. And that balance is resulting in remodeling of the connective tissue. So, in a sense, not only we have to make connective tissue, but we also have to degrade them as well. And here comes the role of matrix metalloproteinase. It is a very important enzyme that is responsible for degradation of collagen and other extracellular matrix components. So now let's talk about MMP, or matrix metalloproteinase. Now, matrix metalloproteinases are a family of enzymes that are produced by a variety of cells, and they are responsible for degradation of various extracellular matrix components. More than 20 members of MMPs have been discovered, and notice the term metalloproteinase. Now, why are we adding the prefix metallo in front of their name? That's because these enzymes are dependent on metal and mainly on zinc. This is a nice thing to know, because sometimes the examiners may ask you, are there other enzymes that have similar function? For example, other enzymes that can degrade extracellular matrix components but not dependent on metal? Then your answer will be yes, and those other enzymes will include serine proteinases, elastases, plasmin, etc. So coming back to the discussion of MMP, now what are the cells that are producing these enzymes? They will include fibroblast, macrophages, synovial cell, neutrophil, and epithelial cells. All these cells can produce MMP, and initially MMPs will be produced in their inactive or zymogen form, and later when needed those inactive enzymes can be activated by different enzymes, for example by different proteases. So there are various types of MMP, and they will degrade various types of extracellular matrix components. For example, MMPs will include interstitial collagenase, and they will degrade fibrillar collagen. Examples are MMP type 1, 2 and 3 will fall in this category. Another group of MMPs are known as stromalysine, and they will degrade amorphous collagen, fibronectin, laminin, proteoglycans, etc. And another group of MMP is also present, and that is known as gelatinase, and they will degrade amorphous collagen and fibronectin, and MMP type 2 and 9 fall in that category. So now that we have talked briefly about matrix metalloproteinases, now we are ready to discuss this flowchart. So this flowchart is summarizing the roles of growth factor, cytokine, MMP in fibrosis. So initially there will be persistent injurious stimulus that can be due to some chronic infection or autoimmune disease or due to trauma. That thing will result in activation of macrophages and lymphocyte. Now always remember, macrophages will be activated in the alternative pathway during repair. So here the macrophages are activated in the alternative pathway of macrophage activation. And we will talk more about macrophage activation at the last segment of today's video. So what will happen after the macrophage and lymphocytes are activated? They will liberate a lot of growth factors that will include platelet-derived growth factor or PDGF, fibroblast growth factor or FGF, and transforming growth factor beta or TGF. And all these growth factors will have a role in proliferation of fibroblast, specialized fibrogenic cells, and endothelial cells. And the ultimate end result will be formation of collagen, formation of more extracellular matrix components. Another outcome of activation of macrophage and lymphocyte will be liberation of cytokines. Now I have an entire video on cytokines, so you can also look into that video for more information. And here the major cytokines will be tumor necrosis factor or TNF, interleukin 1, interleukin 4 and 13, and they will help in increased production of collagen synthesis. At the same time, another outcome of macrophage and lymphocyte activation will be decreased MMP activity. So the matrix metalloproteinase activity will be reduced, and that will result in decreased collagen degradation. And all these things will result in fibrosis. So now we're almost at the last segment of today's video. We will now discuss about macrophage activation. So if you can recall the flowchart, I had said that macrophages are activated in the alternative pathway during repair and fibrosis. So always remember, macrophages can be activated in two ways. One is the classical pathway of macrophage activation, and the other one is the alternative pathway. So here you can see at the center we have drawn a macrophage this one is still not activated. It is waiting for some signal, and that signal will determine its pathway of activation. So whenever microbes or interferon gamma are stimulating the macrophage will be activated in the classical pathway. And always remember, this interferon gamma is coming from T helper 1 cell. And at the same time, look at the diagram. You can see I have drawn in green color and in green icon depicting that the microbes and interferon gamma are activating the classical pathway. At the same time, look, I have also drawn in the red minus icon the other side. So the same interferon gamma and microorganism that are activating the classical pathway is at the same time inactivating the alternative pathway. So what will happen when the macrophage is activated in the classical pathway? That will result in formation of reactive oxygen species, nitric oxide, lysosomal enzymes, and all these things will have microbicidal effect. And also remember, when macrophages are activated in the classical pathway, we call that M1. So one effect of M1 will be microbicidal action. At the same time, M1 will also liberate a lot of interleukins, for example interleukin 1, 12, 23, and they will have a role in inflammation. So what will happen when the macrophages are activated in the alternative pathway? Note that macrophages will be activated in the alternative pathway when they are induced by interleukin 13, interleukin 4, which are coming from T helper 2 cell. And the same interleukin 13 and 4 will also inactivate the classical pathway. So it's very simple. When one pathway is activated, the same stimulus are causing inactivation of the other pathway. So when the macrophage is activated in the alternative pathway, that will result in liberation of a lot of growth factors, and transforming growth factor beta is one of the major growth factors among them. So that will result in repair and fibrosis. So at the same time, there will be liberation of interleukin 10, which will have anti-inflammatory effects. So as you can see, initially the macrophages are involved in microbicidal action, and during that time they are stimulated by interferon gamma and microorganism. So they are causing destruction. And in the later half, when we need to repair, the classical pathway is no longer active and macrophages become active in the alternative pathway, where they, as a matter of fact, prevent inflammation and induce repair. So this concludes today's video on fibrosis. I hope this video was helpful. If you like my videos, do comment, share, subscribe, and let me know. And for my students, I will also recommend you to go through your textbooks for more information. So that's all for today. Until next time, take care and stay blessed. Thank you.